Namaste. I'm Dr. Akshit Gupta, consultant pulmonologist at Apollo Hospital, Kolkata. So I'll be talking to you regarding the two most common interventions that a pulmonologist do, that is flexible bronchoscopy and medical thoracoscopy. So first, we will start with flexible bronchoscopy. So most of you would have heard about an endoscopy, which a gastroenterologist do to examine your gastrodigestive tract. Similarly, whenever there is a pulmonary complaint, sometimes a pulmonologist uses a similar sort of scope to look inside your lung and inspect your airways. So why it is done? There are two types of indications for the procedure. One is therapeutic and one is diagnostic. So the therapeutic indications are few. That is, sometimes there are mucus plugs or a blood clot inside your airway in an old patient who is not able to expectorate, mostly in an ICU setting. So we go inside your airway and take out that clot or a mucus plug. Many a times in a children or sometimes in an elderly, there is the aspiration of foreign body into your airways, which can be taken out using a flexible bronchoscope. And rarely, sometimes there is hemopsis, that is expectoration of blood from your airway. In that also, we can use a flexible bronchoscope to examine the airway, to look from where the bleeding is originating, and sometimes put some medications to stop the bleeding. These are the therapeutic indication of a flexible bronchoscope. But most commonly, it is used for a diagnostic purpose, to obtain some samples to diagnose some infections, tumors, which can be there inside your lung. So how the procedure is done? So the procedure is done under a local anesthesia. In this, we use a scope which is like a tube with a camera and a light source at its end and make it go inside your lung either via the nostrils or the mouth. Once we are inside the airway, we examine it and if required, we obtain the sample using the working channel in the bronchoscope. Either we give some medication, some fluids, or pass some instrument to obtain the samples and then send it later for microbiological and pathological examination. So what's the benefit of the procedure? That it is done under local anesthesia with minimal of distress to the patient and is helpful in obtaining the sample which is required for diagnosing any pulmonary conditions. The second intervention that I'll be talking to you regarding is a medical thoracoscopy, or sometimes called the fluoroscope. So in this, we use a similar sort of scope to examine your lung from outside, that is the thoracic cavity outside the lung. So what is the indication? So the indication mostly is undiagnosed pleural effusion, that is accumulation of fluid outside your lung. And rarely it can be used while evaluating a recurrent pneumothorax and sometimes pleurodiscs also. But the major indication is undiagnosed pleural effusion. So in this procedure, we make a tiny hole inside your thoracic wall. And from there, we put a scope inside your thorax, outside your lung. We take out all the fluid which has accumulated outside your lung, then examine your lung from the outside and also the inner layer of your chest wall. If there is any abnormality over there, we take biopsies from there and send it for pathological and microbiological diagnosis, examination. So the benefit is, it is done under conscious sedation on a day care basis. The patient is discharged on the same day of the procedure and it is helpful in obtaining diagnosis in up to 90% of the cases. So these are the two most common interventions that a pulmonologist do whenever you visit them with various respiratory complaints. Thank you.